Hello, everyone. I'm Chicago Mayor Lori Lightfoot, and it's my pleasure to welcome you to this year's Law and Mental Health Conference. As we continue working to provide mental health supports to residents who need it most, the theme of this year's conference, Alternatives to Police, couldn't be more appropriate. As the pandemic and the murder of George Floyd and far too many others have made abundantly clear, it's time for us to think critically about developing truly holistic approaches to public safety that address root causes and racial disparities. Part of that essential work is developing alternative response teams that can meet residents in crisis with the right blend of health professionals and resources in moments of great vulnerability and need. It's this conversation that's driving a movement across the country to create trauma-informed and medically trained mobile crisis teams. Here in Chicago, we've made incredible headway in this effort, having launched mobile crisis teams just last year. Called the Crisis Assistance Response and Engagement, or CARE. This pilot program initially focused on two parts of the city with the highest number of mental health emergency calls, and has helped to ensure those experiencing a mental health crisis receive the appropriate response from trained professionals, thus reducing arrests, use of force, and unnecessary hospitalizations, and increasing linkages to essential health and community-based social services. The CARE program also embeds mental health professionals into the 911 call center to resolve calls over the phone that do not require dispatch, and to support call takers and dispatchers as they work with persons in crisis. Since the inception, CARE and our team have worked with providers, community leaders, and other stakeholders to center emerging best practices and community feedback in the program design. We look forward to expanding this pilot in the near future. In the meantime, I want to take this moment to acknowledge the stellar work of Deputy Commissioner of Behavioral Health, Matthew Richards, and his team at the Chicago Department of Public Health. Not only have they overseen and implemented programs like CARE, but they also ensure our residents are well connected to the mental health, substance use, and violence prevention services that so many residents need and rely upon every day. I look forward to working much closer with Deputy Commissioner Richards and his entire team. So thank them for helping improve our approach to public safety by strengthening our mental health infrastructure. I hope that this conference gives you all fresh perspectives on how you can implement this important work in your respective cities, and deepens your knowledge and about the importance of trauma-informed response in the public safety space. This is the future, and we must embrace it with gusto. Thank you all very much, and please, everyone, continue to be safe.